Hi everyone, this is Priyadarshini from SNS College of Physiotherapy. Now I am going to tell about bleeding diathesis, which comes under the topic hematology under GMGS pediatrics and geriatric subject. Before getting into the topic bleeding diathesis, we have to know what is meant by hemostasis. Hemostasis is nothing but the process which stops bleeding after the injury. It has three phases. One is vascular spasm, next one is primary hemostasis, and the last one is secondary hemostasis. Primary hemostasis is otherwise known as platelet plug, and secondary hemostasis is otherwise known as coagulation cascade. If there is any defect in these phases or the components, it may cause bleeding diathesis or bleeding disorders. Now we can get into our topic, bleeding diathesis. Definition of bleeding diathesis: it is the abnormal tendency of bleeding or blood loss due to any defect in the hemostasis phases or hemostasis components. Causes: there are two types of causes. One is acquired and another one is inherited. So it may be either genetical or acquired causes. Clinical features may include petechiae, purpura, mucosal bleeding, deep muscle bleeding or deep joint bleedings, and prolonged bleeding after a minor trauma. Laboratory findings may include bleeding time, prothrombin timing, and activated prothrombin timing, platelet counts, etc. Types of bleeding diathesis: there are three types of bleeding diathesis. One is vascular disorder, another one is platelet disorder, and the last one is coagulation disorder or defect. Vascular disorder may affect the vessel wall and it weakens the vessel wall. Examples for vascular disorder are scurvy, Ehlers-Danlos syndrome, and purpura. Key features or clinical features of vascular disorder are petechiae, purpura, mucosal bleeding. The lab finding may include normal platelet and coagulation timing. Platelet disorder: platelet counts, it affects the platelet count and it decreases the platelet count and function. Examples for platelet disorder are thrombocytopenia, Van Willebrand disease, and drug-induced bleeding diathesis. Superficial bleeds and easy bruising are the clinical features of platelet disorder. Prolonged bleeding time and low platelet counts are the laboratory findings of platelet disorder. Next one is coagulation defect. Coagulation defect, it may be due to the defects or any clotting factor. Examples for coagulation defects are hemophilia A, B, vitamin K deficiency, and liver disease. Deep bleeds in joints and muscles are the clinical features of coagulation defects, and prolonged bleeding and activated prothrombin timing are the laboratory findings of coagulation defects. Vascular disorders. So now we are going to see what is meant by Ehlers-Danlos syndrome. It is an inherited connective tissue disorder which is associated with joint dysfunction, pelvic floor dysfunction, and body-wide myofascial pain. So it has the next one is Van Willebrand disease, which is due to the decreased quality and quantity of Van Willebrand factor, which is one of the clotting factors. Now here we are seeing the easy bruising and superficial bleeding and petechiae and purpura differentiations. Now hemophilia. What is mean by hemophilia? We have to know about hemophilia in bleeding diathesis. Hemophilia is a clotting disorder which can occur when there is deficiency of hemostatic components. There are two types of hemophilia, type A and type B. Type A is due to deficiency of factor 8 and type B is due to deficiency of factor 9. Type A is most common type of hemophilia and type B is 4 times less common than type A. Now it is here the disseminated intravascular coagulation which is the coagulating defects of bleeding diathesis. So we have to avoid aggressive manual therapy, mobilization in active bleeders like bleeding disorder patients, which leads to risk factors of hematorosis or muscle hematoma. We have to give gentle exercise, positioning to prevent the contractures. Education on fall prevention, especially in the elders or chronic cases, is very important. Post-bleeding rehab like gradual range of motion, strengthening is once stable, they achieve the stable condition are the important rehabilitation exercise for bleeding diathesis patient. So now we are going to see the summary. And so as I told, bleeding diathesis is one of the most commonest diseases among the people. It may affect about 1 in 5 lakh persons. Now we are getting into the summary, the causes, etc. So there are the applicable questions for bleeding diathesis. First one is define bleeding diathesis and list and classify the types of bleeding diathesis with the example. Third question may be von Willebrand disease, definition, types and clinical features. Laboratory diagnosis of bleeding diathesis are the expected university questions. Thank you. See you in the next video.